My name's Leigh. I'm one of the clinical nurses here at the Sir Charles Gairdner Hospital Intensive Care Unit in Perth, Western Australia. I've been in intensive care now for about 7.5 years. I started my career in London. I moved there as a new grad nurse. Originally I was in haematology, and it was quite funny how I ended up in ICU. It was never something that was on my radar. I mean, I knew about critical care environments, but I always thought I'd be a ward-based nurse. So I was in my new grad program, and then one day I admitted a discharge from ICU, and I met this nurse and we got talking, and I was really inspired by him. He actually later ended up being my mentor in ICU, but he just seemed really confident, self-assured, really knowledgeable. The stuff he was handing over I'd never heard of before. The patient had obviously been incredibly unwell during the stay in ICU, and I just thought to myself, I just want to know what that is. He was using these big terms, and I thought, I'd love to be that nurse that can just talk so confidently and just know their stuff and seem really assured in themselves. So about 3 months later, there was a little advert on the internet at my hospital, advertising for people to internally transfer into crit care, and just talking about what they offered in terms of education, all the continued professional development programs, the crit care course. And I thought, I think I want to give that a go. And I interviewed, and here 7.5 years later, I haven't left yet. So obviously it was pretty good. I joined, I was a new starter. They really supported me. I think that's one of the things with ICU is it's incredibly daunting. I didn't know anyone that worked in the intensive care. I had no friends that worked there. I'd never actually met a nurse before that had worked in the intensive care or crit care environment. So I was going into it completely unknown. But every ICU I've worked at, and I've now worked at 3 intensive cares, 2 in Australia and my one in the UK. And every time I've gone into ICU, I've felt incredibly welcomed. It's such a supportive environment. We love to support each other. We love to promote education and development. And I've just always been able to foster a really good relationship with my colleagues. And that's why I've personally not left crit care yet. And I still enjoy it to this day. That's how I ended up there. In the intensive care, there is always a huge amount of projects going on, both quality improvement and research, and it's amongst all of our staff, so medical staff, nursing, the dietitians, speech pathologists. There's always quite a lot of projects going on. But in terms of nursing projects here at the Sir Charles Gairdner, I know that recently we've been putting a lot of focus on patient experience throughout their journey in ICU, and also families' experience of being in the ICU and visiting on the daily. So a few of our nurses and myself are involved in the project like the 3 Wishes project, which is to do with palliative care, or the provision of palliative care within the ICU. And we've managed to, through the Intensive Care Foundation Fund, is to basically have a supplies cupboard where we have specially made blankets and toys. We also have some specialist booklets for children who might be coming in to visit the ICU, and it sort of just destigmatizes, or at least makes it a little less of a threatening place for families and relatives. And sort of, we understand that coming into the ICU, it's incredibly busy and noisy, and it's quite a scary place for people to be in, and can be quite often traumatizing for many reasons. And even though we try and mitigate those things, it's just a aspect of the environment that we can't always work out for, unfortunately. Across Australia, I think there's been a really big movement towards prevention of admission to ICU, and also prevention of readmission to ICU. So just trying to look at what is it that causes a patient to come into intensive care, and is there any way that we can kind of prevent that as practitioners within the critical care environment? Because although we enjoy providing the service, we definitely understand that it's an escalation of care that we'd like to try and avoid if possible. So looking at that, a big thing at the moment has been sepsis prevention, and looking at deteriorating patients on the ward, going to review them early, trying to put in interventions and safeguards to try and prevent them from deteriorating to the point that they would require our level of care here in the ICU. And that's with I know that here at Sir Charles we've got the Met Call team, and we've got after-hour clinical nurse specialists who will review patients on the ward that are of concern. And that's just trying to prevent them coming back in. But at the same time, a lot of our patients, when they leave ICU, they're still requiring a lot of care. And it's essential that we make sure that they don't come back to us if possible, and that their pathway from there is a nice steady stream out of hospital and back to feeling at least somewhat towards their baseline. Also, the reduction in hospital-acquired infections is really important. So we understand that by intervening or providing care for patients, they are at risk of getting hospital-acquired infections. So we're really trying to promote things like hand hygiene, reducing the number of lines that we do, and also monitoring all of our lines and interventions to make sure that we can prevent hospital-acquired infections. So we do lots of that with infection control. So I know that across ICUs that we're really trying to reduce the risk of sepsis within our patients and across the hospital as a whole. So I think that's really been a big trend, and it will continue to be a trend for years to come because it's so important. And we know that if anybody has a hospital-acquired infection or is diagnosed with sepsis, that they're going to have a higher number of days in the ICU and a higher number of days in the hospital overall, which is not good for the patient experience. When I was at university training to be a nurse, I had some bumps along the way. I wasn't too sure that it was the career for me. I don't know if anyone ever does truly know when they start nursing what it's actually going to look like. And I do think that when I qualified as a new grad, I wasn't 100% sold that this is what I wanted to do. But when I entered the crit care environment and I met people who were incredibly passionate about their job, who were able to make a difference and were really passionate about me being able to make a difference and about me developing as a nurse and as a practitioner, it just kind of inspired me, and I really enjoy looking after people. It's probably going to sound very corny, but one of my favorite things to do is really basic level nursing care. I'd say the satisfaction that makes me sort of buzz or smile at the end of the day is when I have a patient that I can just make a little change or a little something to, whether it be washing their hair after not having their hair washed for 3 weeks, whether it be just taking them outside for some sunshine therapy. I've painted nails on occasion. I have, done face masks or encouraged family to bring in things that are really important for them, made them smile. It sounds silly, but it really makes me smile at the end of the day, and that's what makes it worth it. I really love my job, and I don't see myself doing anything different. I think I'll always be a nurse, and I think I'll always be in the critical care environment because it's just been incredibly empowering for me. It's given me a lot of confidence, and I just love the people I work with. I think it's an incredibly supportive area, with it be the doctors, the dietitians, our HSAs. We have a great community. I think if anyone walks into any ICU, especially our ICU, they'll just see that we all communicate so well and we get on and we're kind of like a family, and it's really a really great place to work, and it's what makes me enjoy coming into work. I don't really ever have a bad day, to be honest. I love it. I'm a big advocate for critical care and ICU in general. I always will be, and I always have been. I think if you're looking to get into the critical care area, just understand that even though it's daunting, there are people there to support you, and there will always be an ear or someone that you can chat to. But I think the most important thing, because it is a high pressured environment and you are going to have days where you feel like the mental load is quite high, or that maybe we're involved in quite an emotional patient journey, I just say make sure that you're keeping a really good work-life balance. So try not to go home and dwell on it. Try and debrief when you're at work, or just let someone know, I'm not having a great day today, or you just wanted to talk through something. We love talking. You'll meet everyone out there, they love talking. It's just something we do. But I really advocate for having a really good work-life balance. Even though I work hard and I work full-time, on my time off, I like to dive, I love to hike, I'm a good reader, I love spending time with my friends, both nursing and non-medical, and I just make sure that I take that time to regroup and just feel like myself. Kate outside of work is very different to Kate, the ICU nurse, and I just have to, when I walk out that door, I'm not the ICU nurse anymore. I'm going to enjoy my free time and make sure that, if I am having a rough day, that I do talk to someone about it. But overall, you will have a great time in ICU or in the critical care environment, wherever you are in the world. It's probably one of the best things you ever do. And even if you don't stick it out in intensive care, it will give you some amazing nursing skills, some amazing knowledge that you will be able to take through to many different areas in the medical world.